Good day everyone. So for today, I'm going to discuss about epilepsy. So for the introduction, epilepsy is a group of syndromes characterized by recurring seizures. Epilepsy syndromes are classified by a specific pattern of clinical features, family history, and seizure type. So let's proceed to definition of epilepsy. Epilepsy is a recurrent seizure disorder characterized by abnormal electrical discharge from brain, often in the cerebral cortex. Or epilepsy is a chronic seizure disorder with recurrent and unprovoked seizures. So for the incidence, epilepsy is the most common neurological problem. An estimated 2 to 4 million people are affected in the US with epilepsy. For this epidemiology, agent factor, exposure to tonics, example, leads, infection, and neurologic injury, and fever. Host factor, age, most common onset of epilepsy is before the age of 20 years. It is higher during the first year of life and at the onset of puberty. Genetic factor, CVA, birth hypoxia, brain tumor, and abscess. Congenital abnormalities, trauma. So let's proceed to the pathophysiology. Disturbance of the brain function due to any causes. Example, genetic factors or head injury may cause brain cells to become overactive and to discharge in suddenly violent disorderly matter. The burst of electrical energy which spreads to adjacent areas of the brain and may jump to distant areas of CNS, resulting in seizures. Clinical manifestation. Clinical manifestation is epilepsy range from starting episodes to prolonged convulsions with loss of consciousness. The clinical manifestation vary according to the part of the brain involved. Classification of seizures and related clinical manifestation, partial seizures and generalized seizures. So, partial seizures, when seizures appears to result from abnormal activity in just one part of the brain. Simple partial seizures, they have elementary or simple symptoms and there is no loss of consciousness in this. So, complex partial seizures, the patient's consciousness is altered during the event. The seizures may being with an aura. Generalized seizures, grand mal seizures. Generalized seizures involve both the hemisphere of the brain. So this is tonic phase. So let's proceed to postictal state. After the seizures, the patient are often confused and hard to arouse and may sleep for hours. So here's the assessment and diagnostic methods. History of events during pregnancy and childbirth, for example, difficult labor, trauma, and birth aphasia. So here's the prevention. Primary prevention, use of safety precautions to prevent injury during birth. Secondary prevention, it includes early detection and treatment of causes. Medical management includes needs for long-term need and immediate treatment of epileptics using medications. So here's the tertiary prevention. It aims at rehabilitation and preventing complication and disabilities. Vocational rehabilitation should be done of the patient through proper training and education in some suitable vocation. So here's the nurse's rule. Protect from injury by removal of sharp objects. So this is the references, and thank you for listening, and God bless.